Hello. I get to be first. I'm Dr. Ethan Carlson. I'm a physician at Baraboo. I've been here for 23 years. My qualifications to speak tonight are that I'm a state of Wisconsin licensed medical doctor with 11 years of post-secondary education, 25 years of ongoing and continuing medical education. I'm board certified diplomat of the American Board of Family Medicine, fellow of the American Academy of Family Physicians, medical informatics director for SSM Wisconsin, and an actively practicing physician whose practice has been involved in the care of medically and seriously ill coronavirus infected patients that we heard about today. We are experiencing a crisis of health and economic proportions like none other than we have ever experienced in our lifetime because of a novel and new infection. Since the outbreak, we've heard the numbers locally. To put it into a national context, 4.38 million U.S. infections with nearly 150,000 deaths. Worldwide, this accounts for 654,000 deaths. Despite my qualifications and those of the scientific community at large, I come to you with humbleness and humility that requires that I acknowledge that the scientific understanding of this infection is incomplete, evolving, and has proven difficult to predict. It is more contagious and lethal than influenza. There is no natural immunity, no highly effective treatment, and there is a questionable likelihood of a preventative vaccine or the development of protective natural immunity in the next year or even longer. We have only the ability to slow and prevent the spread of the virus with good public health measures. We are lucky in Wisconsin that we have experienced less disease burden than elsewhere, but we still have the number of infections that you've heard about today. Many people here have likely still not known an infected person or been affected by the death of a loved one from this. The reason for our relative good fortune is difficult to determine, but despite this, as a community, we need to do better consistently following good medical and scientific guidance on social distancing and mask and face cover wearing. There will never be a study done that's definitively done to prove beyond any doubt that that masks are totally effective and to the degree to which they are effective. This would be impossible to perform, take months and years,
30 seconds.
And would be unethical. There's an inexplicable drive to make this a political issue. It is not. This virus knows no politics. An especially motivated person can argue all day that mask mandates are not effective, but I'm here to tell you that there's evidence to suggest that they would. And I'm sorry that I don't have more time to speak on this matter, but I feel very strongly about it. Thank you.
Thank you. Next is Susan Van Rissler, who has registered against wearing the mask. Susan, do you care to speak?
Yes. I'm not good at speaking publicly, but as for the reason...
Your name and your address,
I'm sorry,
please, for the record.
Susan Van Rissler, 215 2nd Street.
Thank you.
There. And the reason I'm speaking today is I come in to be shopping. I tried doing the mask at Walmart. Panic attack. I had a hard time. I was abused, and so it really bothers me to have anything covering my face, like nose and mouth. I woke up to somebody's hand over my face or a pillow to wake me up. So it's an anxiety. And I also have asthma, so it's really hard to breathe with mask on. I know everybody's like, oh, what about being protection? It's like, what about the person that has asthma and can't breathe?
Right.
What about the person that's been abused and can't handle that because it's like flashbacks? And I was so shaken by the time I went somewhere else that the one lady was trying to calm me down from a panic attack. So those are just a couple of my reasons, which I just feel that it's taking away freedom, it's taking away my air to wear one. And I do take, and I'm not out on the beach every day joining everybody. I'm trying to keep my distance from people when I'm out and about. So I just feel it's, if somebody's trying to play their safe distance, they should be able to go without their mask. And there's so many other reasons that I'm sure other people will touch on, and I don't want to take up too much time with that. It's one of the main reasons for me is I can't breathe and panic. Thank you.
Thank you for your comments. Next, Shane Gibson, who has registered 4 masks. Shane, would you care to speak?
Thank you. I'm Shane Gibson, now 4 Moore Street, here in Baraboo. Good evening. It's become apparent in the last 24 hours alone that it is more important than ever to mandate masks in public buildings and places of commerce to limit the spread of coronavirus and COVID-19. To my reference to the last 24 hours, Baraboo School District Board voted last night to return to in-person schooling. Anyone who has been in school in, I don't know, forever knows that social distancing is practically impossible. Also yesterday, the Baraboo Area Chamber of Commerce released a statement that for an indeterminate length of time, they will be closed due to the possible exposure of a staff member down there. Major League Baseball, 1/3 of the Florida Marlins team tested positive for COVID. Of their 35-man squad, they had 11 test positive a week into their reopening, and this is a multi-million-dollar team with multi-million-dollar reason to keep the disease out of there, and they couldn't keep the disease out of their own team. The NFL announced cancellations of their preseason games. The Minnesota Vikings head trainer and infection control officer tested positive for COVID-19. You know, as a lifelong Minnesota Vikings fan, I'm glad they can catch something. But my point being, these are multi-million-dollar companies with a lot of incentive to keep the diseases out and contained in areas, and even they can't do it. We're sending our children back into the schools, into areas where we know that the social distancing is not going to be able to be maintained. Not due to the fault of the teachers, they will do their best to try and do it, but you just can't control that many kids and keep them apart. We heard at the county board meeting on Tuesday that we don't need to have masks because we can come in and we can take care of ourselves and we can do our social distancing. Look around the room. You know, we're not meeting CDC guidelines in this room. They're going to stand here and tell you they can do it, and they're not doing it here. They didn't do it there. Our health should not be at risk. Our citizens' health should not be at risk because of a few individuals who don't want to wear a mask. There are people who legitimately cannot wear a mask. The lady who spoke before me has very valid reasons, and I'm sure that doctors in the Americans with Disabilities Act would preclude them from wearing a mask. There can definitely be exceptions. Masks, Mr. Locker said it earlier, masks are not 100% effective, but they work. The salon in Missouri, Springfield, Missouri, a woman worked with 139 people. Everyone wore masks. Not one person caught the disease. Masks are effective. Thank you.
Thank you.
Hello, Dr. Kristen Wells, Baraboo St. Clair Hospital. I consider myself a mask expert. I'm a surgeon and I have worn one for 25 years. They're not always comfortable. I am not pro-mask. I am anti-disease. I am anti-unnecessary death. I am anti-transmission of disease if it's not essential. Everything I do is a risk-benefit analysis. I put knife to skin. Well, how could that possibly be good for anyone? There are times that it is. In the risk-benefit analysis, nothing is ever 100%. There is no medical test that's 100%. I had a patient today come in with an obvious mass. Any of you could see it through his shirt. CAT scan did not show it. How could that be? It's a CAT scan. It's not 100%. There's nothing that's 100%. Masks reduce transmission. In the operating room, I wear one not because I'm afraid for my own safety. I'm incredibly healthy and hope to remain so. But because the people I am operating on are fragile. They are delicate. They are in harm's way. It is up to me to help protect them. Now it's up to all of us. There are things we can do. It's not completely out of our hands. Mask is a very simple thing that helps. Will it eliminate the disease? I wish. No, it won't. Will it eliminate one person from getting it? I guarantee you it will. Maybe it's somebody you love, maybe it's not, but is that life worth it? It is to me. It always is to me. So please, help me, help us, help you. We don't want anyone to get sick. Put me out of a job, because nobody needs surgery. Nobody has cancer. I'm okay with that. I will find something else to do. I don't think I'm going to be out of a job anytime soon. Thank you.
Thank you. Next, Steve Witters, registered against the mask ordinance. Steve, fair to speak.
I first want to thank the vets that came out last week to support our rights. Unfortunately, it was a waste of time. We're back here tonight. I'm here to support my rights, my family, friends, and loved ones. We lose this right, other rights will follow, including forced vaccination. Masks don't work. The virus is less than 0.125 microns. Masks filter 0.30 to 0.80 microns. Best place to be is outdoors in the sunlight. The ultraviolet light, the ozone, are all antimicrobial killers of viruses. Worst places to be are in old folks' homes with stagnant air, closed windows, hospitals with closed windows. The virus concentrates and is more dangerous. The virus has a lifetime. There's pandemics every year. This is no different. The virus starts naturally dying off in 8 to 10, 12 weeks. It's a law of nature. It's impossible for this vaccine, this epidemic to be increasing. It's increasing a lot of deceptive ways to increase the positive findings. The gold standard of tests is highly inaccurate. The RT polymerase chain reaction test, the DNA test. The corona is an RNA test. There are multiple false positives and negatives. There's already 30 mutations. They don't even know if it's current or a past infection. The FDA states positive test doesn't equate necessarily to an active infectious virus. MDs and experts are coming forward now with cures now to effective treatment, hydroxychloroquine, zinc, and an antibiotic. In California, if you prescribe hydroxychloroquine, they'll take your license. Why? It's effective, it's cheap, but it's not a vaccine. I'm going to read an excerpt from Dr. Blaylock's report. He's a medical neurologist. It's the best medical newsletter in America. Vaccines in general are often contaminated with viral particles, DNA, RNA fragments, viral proteins, and even whole live viruses that cause cancer and other diseases. Yet there is an even worse effect that most are not aware of, including the vast majority of doctors. During the H1N1 flu outbreak, it was discovered that those who took the vaccine when later exposed to the virus suffered worse complications and even higher death rate than those who were not vaccinated. There's talk of a mandated vaccine being released. In my opinion, this could produce a disaster, more of a disaster than the virus, and the effects of such a vaccine could not be reversed once the path was taken. Thank you.
Thank you.
My name is Randy Zeman. I'm a pastor here in Baraboo. I would just like to say that I am for masks for everybody who wants to wear them. I am dead set against them for anybody who does not want to wear them. I want to talk to, my message will be just a little bit different. My message is about something that Jesus said, "Woe you scribes, Pharisees, and hypocrites," and this mandate is just filled with hypocrisy. We're talking about 3 deaths in Sauk County. 3. Every 54 seconds, we're going to get our choice taken away from us tonight, probably, whether we can have a choice to wear a mask or not. But every 54 seconds, somebody dies from cigarette smoking. Every 54 seconds, but they get to choose whether they want to do that. Every minute and 30 seconds, somebody dies from obesity, just being fat and lazy. But they get to choose to do that. Every minute and 30 seconds. Nobody takes that choice away. A woman can choose to take a live baby out of their womb for 5 months. Nobody takes that choice away to slaughter that baby. That's their choice. And I'm saying all I want is my choice to wear a mask or not. In fact, I insist upon it. I heard something tonight from doctors, the hypocrisy of this. The men that stood up here walked and said and talked about social distancing, walked right back to their seats. Dr. Carlson, who I love desperately, is not 6 feet away. I just built my wife a deck. I know what 6 feet is and what 6 feet isn't. The man in the baseball cap ain't 18 inches away. I know what 18 inches is. I just built a deck. I watched you guys. I watched the police officer. He's not 6 feet away. It's a sham. It's hypocrisy at the highest level. And you will choose who to enforce it upon and who not. And it's whoever you feel like. You don't wear those masks consistently if you're honest. The last thing that I want to say is when the doctor tells me that there's fuzzy data. You know what? That sounds like a car salesman, not a doctor. I mean it. I don't want fuzzy data. I don't want fuzzy data. I want truth. And I'll make my decision based on truth, and I don't want you or anybody else to make it for me. I don't want you to make it for my wife. I don't want you to make it for my children. It's not fair. It's not right. And how about if I start making choices for you? Think about that. You don't impose your will. You're wearing a mask not because you don't want to give somebody COVID. Let's be honest, doctor, because what you said is a lie. You don't want to wear a mask. You want to wear a mask because you don't want me to give it to you or one of these other people not wearing a mask. That's the truth. I love you. I pray for you every week, but that's truth. This whole thing is hypocritical.
Van Buren voted or registered against. Diane?
Hello, thank you for allowing me this opportunity. This is tragic that we are here discussing our right to breathe. This grieves me from the top of my head to the soles of my feet so much because I stand here as the wife of a physician who works and has worked with many of the other physicians who have spoken here tonight. I have 0 medical qualifications, but I am a human being. My understanding is God designed us to, He designed our immune systems to be strengthened by being around other people. Our immune systems are actually strengthened when we are exposed to other people's viruses and bacteria, not the reverse. If that is true, if our immune systems are strengthened by being around one another, then this whole thing is completely the wrong way. That includes social distancing, and that also includes keeping healthy people at home. We are weakening everyone's immune systems, not strengthening them. Be aware. There is so little truth in any of this. This is an all-out attack against God Almighty, against the way He designed our bodies to work. Do not be deceived. I'm just letting you know this is a horrible tragedy, and the people who do not want to wear masks and who feel the way that I do are being publicly shamed and are being made to feel like we don't care about people. Now, if you know me personally, I would like to ask you, do you really think that about me? That I don't care about people? Or that I'm selfish? I'm sorry, but this whole thing is beyond the pale. It is truly diabolical. There is so much going on, and I really urge all of you to start looking into it. Jesus Christ is my God. He made me. My day of death is already written in His book. I will not live in fear of my fellow human beings, and I will not be dehumanized by having to put a face mask on. Thank you.
Amy Steve, registered against. Amy?
My name is Amy Steve. I live M695 County Road HH Linden Station. I am not a Sauk County resident, but my whole family works in Baraboo. Except for I have a son that lives in another state. I want to urge the council to allow freedom of choice. This was mentioned earlier, but horribly, if I was pregnant, I would have the freedom of choice to murder my baby. In 19 states in this union, I could have a baby born, survive an abortion, and the doctor and I could say, yeah, let's kill it. Can you reconcile forcing me to wear this mask? Let's all put as much effort into stopping the murder of lives and quit this foolishness, okay? Let's stop it. If black lives really matter, do black lives really matter? Every life matters. You know what? Abortion kills a huge percentage of black babies. In fact, Margaret Sanger started Planned Parenthood for genocide.
I'm going to ask you to keep your comments.
Okay, to the subject, lies. Okay, here's my subject. BCY America this last Friday, July 24th. News roundup, I urge everyone to listen to it. BCY America, okay? They talked about how Madison is manipulating the test results, not releasing the negatives. I can't give you the exact data, just go and listen to it and they will give you the true facts. Okay, I was in the nursing home today. My mother-in-law, God bless her, she has been in the nursing home and not been able to visit with her family face to face, but today we could. Today we could. We had to wear a mask. She was behind an 8-foot-high plastic fence and they made her wear a mask. She can't breathe very easily, and in the end she kind of slipped it off her thing. We couldn't really hear what she said. It was difficult. That was wicked. And you know what? All the time here, my brother-in-law, who knows, said they've been allowing residents, she couldn't have seen us until now, but they've been allowing residents that smoke to go sit out in the front of the nursing home, and she hasn't been let out. It's not right. Okay? The other thing is, this whole thing, there's a desire to track citizens. It's wrong. And their contacts, where you travel, where you work. There's a desire to force the vaccines. And these vaccines will not have been proven safe. I'm not going to give you a whole bunch more information, but I absolutely disagree with the doctor. This is not a health crisis. It's a lower death rate than the seasonal flu. The treatments with hydrochloroquine and others, that has been suppressed by the media. They don't want people to know that there are alternatives other than this vaccination. It's a fact that the virus is much smaller than the mask virus. It's a fact that mask wearers will rebreathe their own carbon dioxide. They will have lower rates of oxygen. It's a fact that OSHA recommends people to not wear a mask for very long. Personally, I have had a physical job. If I have a mask on and I have to go up and downstairs, it's risk putting me at risk for not being able to see. My glasses fog out. I have treated older people and they cannot understand what I'm saying if there's a mask, because a lot of older people, even though they don't realize it, they are reading lips. And you are robbing them of communication. Excuse me? Okay, thank you.
Thank you.
Thank you.
Sonia Carpio, registered against. Sonia?
Hi, my name is Sonia Carpio. I live at 1221 2nd Street. I came before you to make your decision on mask mandate with a few questions to pose. What is your purpose for this mask mandate? In the draft ordinance on page 49 of tonight's agenda, it states the alarming rise in new cases of COVID-19 in Sauk County. Isn't this rise in cases what we would expect? We have increased testing for COVID-19. We're now out doing business in the community. The virus is in our community and will be for an unknown length of time, so we would expect to continue to have a rise in cases. I would be alarmed if there were increasing deaths. There have been 3 deaths from COVID-19 in Sauk County. The last was in April, during our safer at home orders. I would be concerned if we were seeing increased hospitalizations from COVID-19. I don't believe that that's the case currently. Our hospital is not at capacity or out of resources, which was the point of flattening the curve. That seems to be the point to those at risk in the community should be protected and well cared for by others, and so it seems that we must be doing that if they aren't ending up in the hospital. Draft ordinance also states on page 49 that this mandate would be to protect the health and economy of the city of Baraboo and general welfare of persons within the city, as well as necessary to keep businesses and the economy open. Many individuals in our city are wearing masks, like yourselves. A number of businesses in our city have recommendations, and some have mask requirements for entry. Is mandating everyone in the city and every business in the city to require masks helpful? Does the city know a business's clientele and management of their business better than they do? We say we're Baraboo United, but does a mask mandate help us look at each other as one, or question others for what may be personal and sometimes private reasons that they have made a decision whether or not they should be masking? If a mask mandate is enacted, do we encourage reporting on our neighbors and others in our community? Does monetary punishment help in a time of financial strain for many individuals and businesses? Is that beneficial? Does this help our community, which says it benefits from tourism, when tourists may be unaware of our city having a mask mandate? My final question is harder. If the city of Baraboo enacts a mask mandate, when will it end? Some say when the risk is gone, or when there's a vaccine, or is it when there aren't cases anymore, or after a bad flu season is over? An individual is currently free to mask as long as they feel is necessary and answer those and other questions for themselves based on their personal situation, as well as the data that the health department and others are sharing with us. So thank you for your time and attention.
Thank you. Mr. Reese, registered against?
I don't have anything more to add to it.
Okay, well, thank you. We will put it into the record. Your address is 1211
Second Street.
Street. Thank you. Steve Higgins?
He left.
Okay, he did register against. We'll read that into the record. Kurt, I believe, Kurt Gotzman, 503 9th Street, registered 4.
Hi there, Kurt Geckerman, 503 9th Street, Baraboo. First I just want to say I generally am thankful for everybody here and the tone. I mean, I think no one's really attacked anybody. We're all Americans, we're all from Baraboo, we're in the boat together, whether our disagreements aside. I do work in a nursing facility to take care of senior citizens. I'm not a medical professional, but I've spent many, many years working in that setting. I think there's no doubt that if you look across the country, some of the horrible scenarios that have occurred in nursing facilities. And that's, I don't think any debate really whether that's due to COVID or not. COVID has killed many, many people in nursing facilities, and it's a huge percentage of the number of deaths. If I go home and I go out to the store and the level of COVID is increased because people aren't wearing masks, I mean, there are people who debate that, but I think the preponderance of evidence, and I have to make a decision somehow. What do I look at? Somehow I have to decide. And when I look at the preponderance of scientific evidence, it seems to me that the bulk of it says mask wearing produces this. If I come back and I've got COVID, I have a greater chance of getting COVID, like going to the nursing facility to work, and it gets loose in that facility, you've got a major problem. And you're going to have very likely a high number of deaths if it truly gets loose in the facility. Now, we're doing everything we can there, but it's been proven that this is a susceptible population. And by wearing masks, we're helping them. We're also helping them to get rid of some of these. If we can reduce things, right now we're under restrictions, and we heard some of that about how we're restricting as far as visitation and such. Quality of life, it's a huge issue. And if we can make it so, there are tough decisions coming about when we do that, just like here. But if we can make it so we reduce that, at some point, maybe the decision will be easier to open up restrictions on visitation. And these people really could use that. I mean, quality of life is a huge thing. And weighing that against COVID is a huge thing. I don't know if there's a right answer, but I know right now that if it does get loose in the nursing facility, then you're looking at possibly catastrophic deaths in the facility. So I guess I would just ask to consider that kind of a scenario for the community and how you can help us.